to the latest numbers for Singapore's COVID-19 vaccination program. According to the Health Sciences Authority, serious reactions to vaccinations are very rare, affecting 4 in 100,000 people here. Between December 30th and April 18th, some 2.2 million doses of the Pfizer and Moderna vaccines have been administered. There have been about 2,800 cases of suspected adverse reactions, of which around 70% involved people who were younger than 60 years old. Among the cases, 95 were serious adverse effects, which include 20 cases of anaphylaxis and 25 cases of Bell's palsy. Prof, that's a lot of information to digest. Were any of the results surprising for you, say comparing the findings with other countries?
So I was actually assured that what we have seen in Singapore in terms of known adverse events, whether it is mild or serious, are very much in line with what other countries have been reporting. So our rate of suspected serious events, as you mentioned, is about 4 in every 100,000 doses administered. And one of the most worrying serious events that you mentioned is anaphylaxis, which can of course be life-threatening if not managed early. And we have seen that the figure for this is actually very, very low as well. It's about 1.4 events out of every 100,000 doses. And this figure is in line with what other countries have been reporting, which is between 0.5 to 2 events out of every 100,000. So more importantly is also that we haven't seen any evidence of unknown adverse events, such as the blood clots which have been reported for other vaccines that are not used in Singapore. And in other words, the vaccines that Singapore uses from Pfizer, from Moderna, we do not actually see any evidence that they cause any previously unknown adverse events. And this is aligned with what we have seen internationally as well. And for example, in the United States alone, there have been more than 240 million doses of Pfizer and Moderna vaccines being administered as of yesterday, and there have not been any links between these vaccines with previously unknown adverse events. So what was shared yesterday was very assuring because the COVID-19 vaccines we have in Singapore remain safe for people to use, despite the fact that they will cause known mild side effects such as rash, fevers, aches and pains, and even the more serious side effects that we know about, they are known and they are actually very rare.
Given what you've just mentioned, should it then come as a reassurance to people who are still hesitant about getting vaccinated?
Yes, indeed, because I think this is where we need to separate out the mild side effects that we talk about, the rashes, dizziness, fevers, aches and pains, some itchiness, which is what accounted for those 2,800 reported adverse events. The numbers look a lot, but those are very mild and known side effects. They are not life-threatening, and the symptoms actually go away after a while. And we need to separate those from the serious adverse events, which is what you talk about, anaphylaxis and other more severe allergic reactions. Those are very rare. You mentioned 4 in 100,000. And just to highlight also that there are many safety checks and layers of safety nets built into vaccination protocols worldwide, especially the ones that we have in Singapore. So for example, the first safety check is that prior to the vaccination, if you show up at the vaccination center, there is always a pre-vaccination screening where you will be asked whether you have previously experienced any allergic reaction to food, medication, or other vaccines. And if so, they will evaluate whether you should proceed to be vaccinated. Now, just before the actual vaccination itself, before the nurse sticks the needle into you, there will be another verbal check to make sure that you have no prior allergies to food, medication, and vaccines. So these 2 layers of screening will already help to pick up those people who previously know about their history of allergies. But the question is, what happens to those that may not know about their allergies or may have never experienced it or perhaps just have forgotten about their allergy history? And this is really where the post-vaccination observation becomes important. So after a person receives the jab, have been vaccinated, they have to remain in the observation zone for 30 minutes. And this 30 minutes, you will be monitored. And if you experience any problems, any uneasiness or discomfort, you can actually sound out. And this 30 minutes is already double what is internationally being recommended, which is 15 minutes. And most of the severe reactions that we have talked about, they tend to manifest within minutes after receiving the vaccination. And that's where they can be identified during this 30-minute observation period. And of course, the last layer of the safety net is how every single vaccination center in Singapore for COVID-19 vaccines is equipped with the necessary medical equipment and the trained medical personnel to handle precisely the kind of medical emergencies that will come about because of this vaccination. And all of these different layers of safety nets come together to ensure that people going for the vaccination do not suffer from bad experience or an adverse medical event. And of course, at the same time, Singapore continues to monitor this space of adverse events very closely with other regulatory agencies, be it in the United States, UK, Europe, Japan, to make sure that any knowledge of known, unknown adverse events are quickly shared and communicated.
Now, separately, your team was commissioned by MOH to conduct a study on cases of suspected vaccine-related stroke or heart attack. Your team found that there has been no overrepresentation of these events so far. Professor, could you elaborate on the findings?
So, one of the concerns is whether some of this news that have surfaced in social media, be it locally or internationally, about how taking the COVID-19 vaccine results in life-threatening events such as strokes, heart attacks, and whether such news have any basis. And there are different ways to approach this. The first is to really think about evaluating the evidence linking the vaccine with the occurrence of such medical events. The first is, of course, mechanistic in nature, where there is the proper clinical assessment to the cause of the medical events. The other is actually looking at the epidemiological signals, meaning, do we start to see a lot more medical events happening to the people who have just received the vaccine? So my team was commissioned to look exactly at the latter, to look at the epidemiological signals. And in order to do that, we needed to understand, on average in a single year, what is the baseline number of strokes and heart attacks that we would have seen in Singapore anyway. So for example, back in 2018, there were exactly 8,326 cases of stroke and 11,887 cases of heart attacks. Now, based on these numbers, we can look back and see how many do we expect to see in a single day, especially for people within a specific age group, such as 60 and above, since the risk of strokes and heart attacks do vary by age as well. And based on that, we can start to determine, given the number of people that have been vaccinated, how many cases of stroke and heart attacks would we expect to see by chance, meaning nothing to do with the vaccination, just within a 24-hour period post-vaccination, or within a week after vaccination, or within a month after receiving a vaccination. Now, if there is a genuine link between the vaccine and any of these major events, we will start to see a very consistent signal that much more people are experiencing these events after they have been vaccinated. And this is one of the ways that actually have been used to link the blood clots incidence occurrences with some of the other vaccines that I emphasize again. Those vaccines are not used in Singapore, but there have been an established relationship between blood clots and other vaccines. And locally, there is no evidence that we have seen more strokes or heart attacks than what we would expect, given the number of people we have been vaccinating. And this is also true worldwide, not just for the local data, that for the people vaccinated with Pfizer, Moderna vaccines, there have not really been any over-representation of strokes and heart attacks. And as I said, this is one of the ways, and the mechanistic clinical evaluation is another. By combining the insights from different approaches, this presents a very consistent picture to us that both locally as well as globally, there is no link between the vaccines that we use in Singapore and major events such as stroke and heart attacks.